Good morning, everyone. It is Tuesday, December 21st, but we aren't actually here today. We have recorded this introduction to one of our very favorite episodes for you to enjoy while we are spending time with our families. And we sure hope you are enjoying the holiday season too. Do you guys remember what our COVID numbers were like this time last year?
Yeah, that was not good. Not good. No. Oh yeah, we were in the midst of a huge surge of patients, which put a terrible strain on the whole health system right over the holidays. Hawkeye, what were our numbers 1 year ago today?
Yeah, you know, it's hard to believe, but it was this high. We had 79 patients with active infection. We had 30 in the ICU and 22 on the ventilator. And we still had 59 in that recovery period. So we had a total of 138 patients, but you know what? That was down from 149 total patients the previous day.
Our numbers have improved quite a bit since then, but we are not out of the woods yet, so we have to stay vigilant. We have to stay careful.
Well, we hope you enjoyed this encore presentation, and we will be back live with you on Monday, January 3rd. Happy holidays!
Or what could happen if we don't do the right thing? Here comes coronavirus, here comes coronavirus, right down pandemic lane. We know the answer, we can beat this, get your vaccine today. That's the way.
I love it.
We can bring holidays to all of us, the greatest gift, taking care of each other.
So good.
Hey, good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System, broadcasting live with you from our very festive holiday season, Dolph Simon's family studio here at the University of Kansas Health System. We're delighted to be back with you. We're kicking off holiday week, and we're going to have a little bit of fun this week, but we're also going to be pretty darn serious about some important events that are going on around us with this darn virus. But first, let's start out with Hawkeye. How are we doing today?
Yeah, hey, numbers are a little bit better.
Yeah.
Still lower. We'd like to see that, especially
even lower
coming up for these next few weeks. We have 79 acute infections in the hospital right now, so that's better than it was even last week. 30 in the ICU and 22 on the vent. So still a high proportion in the ICU that are on the ventilator. We do have 59 patients who are still here in that recovery type period as well. And
that
in Hayes,
total is below 140.
Yeah,
that's like a 138. So that's an improvement too. We like that
because we've been hanging out in the 160s for a long time.
We were. And our CMO call last week, you know, several places had numbers that were higher. So it wasn't like the overall area felt pretty stable. We were a little lower, at least a little higher. So
I think there will be variations, unfortunately, but lower is much better. And then in Hayes, 27 infections as well. So 16 of those are active and 11 of those in recovery. So even their acute infections seem to be decreasing as well, which is another good thing.
Yeah, so that's really good news. I also want to introduce Jessica Callender-Rich. JKR is the leader of some really important things. She is she practiced in general and geriatric medicine and was appointed to the Coronavirus Commission for Safety and Quality in Nursing Homes early on in the pandemic. So it's really important that you're with us today as the vaccine begins to roll out. And Hawk, we know from over the weekend, the Moderna vaccine is starting to roll out today. So that's really a good news.
Yeah, hopefully deliveries starting early, this week, today and Tuesday, and kind of on from there. So I think it's really good news.
And this vaccine, the direction of those deliveries is a little different than what it was with the Pfizer vaccine because it doesn't have to have the super cold storage. So it's going to be going into more rural areas and into counties, into federally qualified health centers, county health departments for distribution to healthcare workers and other essential personnel, and to nursing homes. We're going to turn to that in just a minute. But Hawk, I know there's going to be questions about this new virus that may be, our new viral strain, I should say, that's emerging in England. Thoughts about that?
Yeah, there's very little data available other than from really the news stories. There are some isolates that also is found in Australia and Denmark and the Netherlands, I believe.
And South Africa as well.
In South Africa, yep. So it's not new. And remember, early in the spring, there was this one form that became or has started to become more dominant. That's the D614G, that amino acid substitution that just kind of makes the spike more in that open conformation, maybe makes it more transmissible as well. It's really hard to say exactly what we're going to have to deal with this new finding. More data is needed, more scientific research. there is that concern on those news stories about maybe the vaccine won't get it. It won't protect against that strain. I think it's really too early to tell. We have to understand these viruses, particularly these RNA viruses, do mutate all the time. They have mutations that are present. Most of them, single mutations, don't really cause a problem. And by single mutation, I mean one base pair in the genome is a single mutation. So I think it's, again, still too early. Clinically, though, it doesn't look like that isolate or that virus causes any more severe disease. May just be more easily transmissible. We don't really yet know if it will escape or evade the immune system from the vaccine.
Yeah, the one thing I had read from one epidemiologist, they thought that this actually made the spike protein easier to get into your cell.
Mm-hmm.
It wasn't clear if it was as virulent, though. That was interesting. But that the current Moderna and Pfizer vaccines should be protective because the regions of the spike protein that those were going after with antibody production still were intact. And so it doesn't seem like those are going to shift for us.
Yeah, and that's going to be the important thing. You know, it is this spike protein, and you will make different antibodies to all these areas on the spike. Now, there are probably one or two that are more important because of actually where the antibodies bind on that spike protein. But hopefully the vaccine will still confer protection, and this mutation won't be really significant as far as obtaining protection from the vaccine itself.
So JKR, you introduced the thought that we are building the airplane while we fly it. Mm-hmm. I want to remind you, because it's holiday week, we are now going to be talking about building the sleigh and training the reindeer while we fly them. So let's be sure. Let's make sure we get our is that a simile? I think it would.
I'd have to ask my fourth grader.
Yeah, me too. Okay, great. Well, let's talk a little bit tell us a little about how the vaccine's being rolled out to nursing homes. What's that process look like? Who's getting vaccinated? When is it going to start? When are you going to be done?
Oh, that's a lot of questions all at once. Okay, so, early on as we started thinking about how to vaccinate all of these folks in the long-term care setting, it became really clear that there would need to be partnerships with people who already understood how long-term care pharmacies work and how distribution could happen. And so, a partnership was created, actually between the federal government and then CVS and Walgreens to help roll this out across the country. Every facility in the entire country had a deadline at which time they had to sign up to choose either CVS or Walgreens to be their partner. Some facilities did choose to stay with their home pharmacy, with the people that they've always used, and that rollout will look a little bit different, but for the large majority, CVS and Walgreens will be their supplier. So as CVS and Walgreens get their vaccine supply, they are rolling out to send, first of all, they're scheduling times for each facility. They'll have a minimum of 3 clinic dates, they're calling them. And at those clinic dates, the facility will have, CVS or Walgreens will come in, will do the vaccine, will observe the patients and the staff as they receive that vaccine. And then we'll follow up and come back for a second clinic date and then a third clinic date if needed.
Hang on one quick second, JKR. I think we need you to hit your button on your mic right there in front of you. There you go.
Oh, it was
well
silent.
done. Hopefully people still heard the brilliant analysis you just gave us. Summarize it real quick, just in case.
There was a partnership with CVS and Walgreens by the federal government. They're rolling it out to the facilities. They're coming in and doing it. There's a process in play.
Well, that CVS Walgreens thing is just to say, 2 ultra competitors coming together for this. That's pretty cool stuff. And if I read it correctly, the pharmacists are themselves driving into the nursing home and doing some of the injections. Is that right?
Absolutely. So they are coming in. The facility will set up a space for them, and they will come in and do the vaccinations in the facility. The residents don't have to leave. Importantly, the staff don't have to leave. Everyone who works in that building or who lives in that building will get vaccinated at that time, assuming the consents are all signed by all the responsible parties.
And I'm so thankful my father had to sign the consent for my 97-year-old grandmother who's in a facility, and hopefully we'll be getting hers in the next week or so. Yeah.
My kids kept texting me. I had to put it on silent. I think they think I'm a goof. Can I just point out, I did wear a Christmas tie today. And yes, if you look carefully, it is a fly fishing Santa Claus on this Christmas tie. Okay, so explain to us the importance at this moment in time about this pandemic. Why is this especially important, and how do you think this is going to affect the severity of illness coming out of nursing homes and what that could mean to the healthcare systems?
We know that nursing home residents are the highest risk people when they get COVID-19, but also the highest risk of being exposed because of their congregate living situation. So as we work together to help prevent disease and prevent spread within the facility, we also help prevent spread and patients coming to the health systems, leaving more room for other folks that may need that care. We are working so hard in the nursing homes to really do everything we can in the interim, and we will continue, of course, even after vaccination, to do everything that we can to prevent any viral transmission and all the infection control practices that have already begun.
And do you think this means visitors get to go to nursing homes soon?
Soon is a matter of
Interpretation.
perspective. I think that it is one step in a really important pathway to getting back to visitors.
So really what you're saying is we truly are building the sleigh while we get ready for Christmas and fly in.
I can't wait to see that sleigh fly.
Me either. That'll be awesome. All right, well, let's turn to reporters and see if there's questions that are out there.
Good morning. We've got Charlie Keegan here from 41 Action News. How are you all doing today?
Good, thank you. How are you?
Great. Happy Monday. I have a story a little bit off topic this morning about face coverings. I've seen different advertisements for face coverings with lights, with windows, with beaks, and all sorts of things. So I was just wondering if you guys could give a quick 1 or 2, 3 things that a face mask should include to make sure it's effective as people go out looking for all these cool, neat, fancy face masks.
You know, I look for some really cool face masks that would give me a little bit more of a chin and a little less of a hanging neck, a crow's neck. And, you know, I didn't find one. So I was a little disappointed by that. But, Hawk, these other face masks, what do you think? Are they going to help us? And what do you have to do to make sure that they're still safe?
Yeah, I think the biggest thing to make sure that they're safe is understand that it has to be that barrier. So the barrier from the top of your nose or the bridge of your nose down to your chin. And then it should be have protection on the sides, obviously, for using air loops for that. The barrier is the biggest part. We know that there are face masks out there with valves. I think those valves are okay if there is some material in those valves. It's not just an air valve that just lets air out, because we want that barrier protection. Conversely, with that barrier protection, you as the wearer, even with a 2 to 3 ply cotton mask that you can get, or we can see even people have made them at home, those will offer some protection to you, the wearer, as well. But the biggest thing is to understand the concept that you want that barrier from your nasal passages in your mouth, so that when you are breathing, laughing, yelling, there is that barrier protection there against any virus that may be expressed out into the environment.
So I think those are going to make it safe. And the same thing is true for our seniors. I think that the same logic applies around mask wearing.
So I don't have a fancy microphone. You'll have to repeat
I do.
the
No.
question.
So the question I think in this case is, are there special requirements for masking? Because there are a lot of lights and different things. People are starting to put on masks. But for our senior citizens especially, got to stick to those basics around mask wearing.
Yeah, absolutely. I mean, the masking is the critically important piece of all of this. We have seen people that have, really turned around and have facilities at Whole that really didn't understand the needs for this in the beginning, way back in March and April, that are now being really diligent about wearing the right kinds of masks. We do, in the facilities, have to wear surgical masks. That's a requirement. But there are also facilities that are using higher level respirators, and we just have to do everything we can to protect our residents.
Yes, you do. All right. Other questions?
Yeah, this is Ellen McNamara with KCTV5. Hi, guys.
Hey, Ellen. Hey.
Hi. Yeah, so I have questions. One's going to be quick, and the other one's probably going to be a little bit longer. For the Moderna vaccine, are you guys using the same simulation system that has been set up by the government to look to see what's available for the Moderna versus the Pfizer? And I know that might be more of a KDHE question too, And then my second question is, over the weekend, we saw a lot of lawmakers getting vaccines. And, yes, there's an understanding that, the government has to run and these people need to get vaccinated. But then we're also starting to hear about people that, like a former disgraced governor got a vaccine. And, you're starting to hear about people already saying, well, if I donate a bunch of money to a hospital, can I get a vaccine? So can you guys also address just kind of like the ethical issues that, I feel like this is just going to be the beginning and we're only going to see more of this. And, is it frustrating that some people who probably shouldn't be getting a vaccine are before frontline healthcare workers?
Yeah, you bet. So let's take on that first one. And Hawk, I think as far as when we can forecast and how it's being distributed and some of that information, that does reside with KDHE.
Yeah.
No, we don't really have, we just kind of get told, here's the numbers you're going to have.
Right.
And sometimes if we're a distribution center, then we may know that we're going to get X number of vaccine altogether, let's say, 10,000. I'm making these numbers up. Mm-hmm. Maybe we get to keep 100 and we have to distribute the other 9,900. And we don't really know that too early on.
No. And, certainly the federal government goes down to the states. The state, we do work with the state. We've had meetings with them. They are really trying to allocate it to all the health systems, the hospitals, the places in the state in an equitable manner. It is difficult. There will always be people that have concerns or problems with the way it's done, but they are taking a very thoughtful look and role at trying to do it in an equitable manner because we know that the supply is very limited and the demand is so high at this point.
So, JKR, one of the questions is the equitability of vaccine distribution and whether people should be able to jump in line. I think when we think about our nursing home folks, they're especially vulnerable, and it feels like they ought to be at the top of the list.
And thankfully they are at the top of the list, because I think you're right. Their vulnerability and inability to really do the things that we're telling everyone to do, right? We're telling everyone, stay home, wear your mask, physically distance, and they just really can't do that because of their needs. And so putting them at the top of the line, clearly makes sense. And we've seen that really roll out in the same way really around the world.
Yeah, we have. So I think at the heart of this question is who should get the vaccine first. And I think that the CDC, again, affirmed this weekend, although extended their prior recommendations, because they really said the first priority should be healthcare workers, because we're trying to handle the crisis in hospitals and critical care right now so that patients can get care. I refer you back to about 2 weeks ago, and we got a call from down around El Paso, Texas, that there were 14 COVID positive patients who didn't have an ICU bed, and they were asking to transfer them up to KU. So, that's what happens when you don't have enough staff and you don't have enough beds, and people move far from their loved ones. And we know when you don't have contact and emotional support, that hurts your outcome chances. There's just so much wrapped into this. I think that truly we need to vaccinate those folks. And then the CDC extended it this time. They also said if you're over 74 years of age, that's the next group. You go healthcare workers, and then essential workers, and those over 74. So they broadened the category a little bit this weekend, Hawk.
Yeah, and I don't have a problem with certain leaders getting it. Vice President Pence got it. Obviously, we need to continue to have our leaders getting it. That's something different than who is just a celebrity. We haven't gotten it. I haven't gotten it here because I feel that there are people in the health system here who need it more than I do, who are at that higher risk. We are starting to get more vaccines, so we are starting to roll those out into our next tier of people that will be, my colleagues in ID. Certainly I will get it when it's my time, but I definitely feel there are more people who need it than me. So I think it's getting it to those populations is going to be the most important thing, and we are working to do that as well as possible, identifying risk. Another reason is because it's not going to change my practice. It's not going to change what I do in the near term. I'm still going to be distancing, not meeting in large groups, still going to be masking. So I just really want to get it to those people that are the highest risk of having hospitalization and severe disease.
And JKR, again, I point to our senior citizens. We've got to get those folks vaccinated.
It's critically important. I was really happy to see that they had sort of expanded and described what that next tier would look like.
And so let's talk a little bit. I know we're not going to go, we're going to stay on the public health policy aspect of this. And as a matter of public health policy, I think you have to vaccinate the people who are the most vulnerable, because that's where the people who are going to come in and get the sickest in the hospital. It's not how much money you make. It's not who you are. It's where you are in terms of your degree of vulnerability. So here's what we know. If you'll wear PPE and if you'll follow the rules of infection control, you can stay safe. Now, it can be a pain, right? Holidays look different, Christmas looks different, but over the next year, we're all going to get vaccinated. It's going to come to all of us. That is, you're going to have the opportunity to be vaccinated. Hopefully you'll take that opportunity. So by this time next year, we really should be in pretty darn good shape. But trying to jump to the head of the line and pushing down somebody who has all the healthcare vulnerability that you don't have, that just feels a little goofy to me. And I'll say to you that I think the best thing to do is follow the recommendations that we hear from public health policy experts, we hear from Fauci, and we hear from other leaders in the field. And we think that is to follow the questions about who is the most vulnerable, who do we need to protect. And I think that's the way to stick to the equation, because we know we have that. Now, the next question is, we have to make sure that amongst facilities that the vaccine distribution is equitable. And I think we still are working on that, and part of the problem is there's still a shortage of vaccine. So until we get more vaccine, it's going to be a little difficult. Someone's going to feel left out, because the problem is there's not enough. And the question is then, if there's not enough, how do we give it to those most vulnerable? I think that's what we're trying to do. And if we can just stick to that principle, then we'll be a lot better off than other principles about income or wealth or celebrity status. It really needs to be about where you are on your health status. And remember, we are all in this together. It is not I the one. It is we the people. And only if we take care of we the people will we be able to successfully combat this virus. The best way to handle that is to come together and not try to peel off. United we stand. That's how we have to look at this question. Other reporter questions? Okay, I'm not hearing any. All right, Jess, you're up.
Hi, good morning. Okay, so lots of questions for Dr. Calendar Rich today. So Donna and Barbara both have similar questions. If you're 75 and older, you're not living in a facility, will you be notified? How will you be notified? Where will you go to get your vaccine?
So I'm not sure that we clearly know the notification process yet, but what we do know is that it will more than likely roll out through the Department of Health at the county level. And the clinics will be set up. I know specifically Wyandotte County has plans to set up a specific number of clinics where everyone can get online or can call in and schedule their appointment to come and get their vaccination done at the Department of Health. And the same is true likely for all of the counties across the state.
Yeah, I think that recommendation just came out from the CDC on the weekend, Hawkeye. So it's a change, and I think it's a good change. But I think that means we're going to have to start trying to figure out how we implement that change.
Yes.
Because at some point, especially with the Moderna vaccine, this needs to be carried out in clinics, because that's the only way to get to this population. To say, oh, we're going to have all at age 74 go to the health department. That's a big number, folks. So I think we're going to have to start getting into primary care clinics and other places with vaccine distribution. But to get there, we got to get a lot more vaccine before we do.
Yeah, and I think we will get there. Again, we know that pharmacies and clinics have supplies of Pneumovax, the pneumonia vaccine. They have supplies of influenza vaccine, tetanus vaccine. Nobody is clamoring to get in there. They're not filling those spaces up. So the supply will get there. It's just going to take a little bit of time. And once that is done, people will have ready access to those things. But I think to Jessica's point is, it's not really clear how you'll be notified, who will, I'm sure in the news media and, again, local media outlets with their local health departments, there will be some messaging at that point.
Here's the miracle of modern technology. If you are on MyChart, if you're on any electronic medical record, you can send messages to your patients. And when you have vaccine in your clinics, you'll be able to send out messages and say, hey, you guys need to come in. We have this 10-day period to do people who are 74. Then we're going to go down to those who are 60. Then we're going to go down to those who are 50. There are ways that we can roll this out, and hopefully we'll be able to get to that pretty soon. But I think that we just have to have a lot more vaccine. So any updates on AstraZeneca's vaccine? Anything you're hearing, or the J&J or the Santa Fe one?
I haven't seen anything from over the weekend at all.
Yeah, I haven't either. I think we're hearing that the Astrazeneca results ought to be out in late January, early February, and J&J by the end of February. So, man, if those guys hit, that'll be a big deal.
That would help just more people to produce vaccination to help prevent, disease and severe disease especially. So we'll take a look at the vaccine trackers today. And
yeah, that would be great. And one other point just to be made about the upcoming holidays. So we got to be careful. We know. I mean, the nursing homes are a great example, JK. By the way, Jessica Conrich, JK, we know in the nursing homes what happens when there's widespread. I mean, right, this virus can jump from person to person, but we also know that when we do the right thing, we can limit infectious spread. Talk to us a little bit about how that happens in a nursing home.
Yeah, so the nursing home residents that are really used to coming together and doing a lot of activities together are now really having to rethink the ways that we do that. So there are things happening. So it's a little bit challenging. Places that are having active outbreaks are going to keep the residents in their rooms still. They really have to do that. But anywhere that's not having an active outbreak has the opportunity to manage the virus in such a way that includes masking and distancing, but still letting people perhaps come into the dining room, a big open space, one person at a table, well spaced out with masks on, to do the things that we often do at holiday time, listening to holiday music and participating in certain activities. But it does have to be limited, and unfortunately that limits us from things like the big Christmas dinner that I think all of us are used to.
And I think that, to your point, to your second point, a lot of this right now, even in Europe, the epidemiologists and scientists are saying a lot of this is still driven not just by the isolate, but by behavior. And we've talked about that it's the behaviors that are helping drive this spread as well. We know from that Boston original super spreading event way back.
Meeting, back in
there were
March,
250,000 cases, I think, linked to that one episode. So a lot of this, yes, there may be this new isolate that is more readily transmissible, but maybe doesn't look like it causes severe disease. We are still waiting for the full scientific data on that. But a lot of this is driven by behaviors as well.
And I think another interesting thing, in the New York Times this weekend, they had a tracker map of the Thanksgiving effect throughout the country. And I'm happy to say that the Kansas City area was, at least I believe it was a minus 10% in terms of gatherings and things like that from what we normally do. And that was sort of their range, minus 10 to plus 10%. And so, the message gets across. And if you follow the rules of infection control, you can stay safe. You can stay safe. And we may be building this sleigh while we fly it, but by golly, you can stay safe. And that is the greatest gift that you can give for Christmas, Jess.
Okay, so many good questions. Joanne says her mom has Alzheimer's and had COVID already. Her brain fog is awful. I've heard that COVID advances Alzheimer's. Is this true?
We do worry that COVID has some long-lasting neurological effects, especially, anytime somebody who has underlying Alzheimer's or any kind of dementia, anytime that they get sick, they have the risk of declining in their cognition. And so specifically with COVID, we have seen worsening of that, and that's all the more reason that we have to really prevent more people from getting COVID and really start thinking about vaccinations as they roll out.
Okay, so Haley wants to know, do healthier older people have better outcomes with COVID than perhaps an unhealthier younger person?
Oh, that's a good question. I think everyone seems to react a little bit differently, and it's hard to predict. From what I have seen, and I'll defer to the other folks at the table, from what I have seen, a healthier older person seems to, for the most part, do better than an unhealthy younger person. But again, it's a little unpredictable. And sometimes we find that healthy older adults are really using all of their resources to remain as healthy as they are, and something that is something that we wouldn't expect to cause long-term problems does.
So, Hawk, what do you think? I mean, in general, and the problem is it's not an off-on switch.
Right.
There's degrees of how healthy and how unhealthy you are.
Yeah, there's a bell-shaped curve on who is going to develop severe illness. Certainly, putting yourself in some of those higher risk categories, again, age, but we're talking about age versus somebody who's not as old. I think the other really two major things that we're looking at is going to be the BMI. Are you obese? What is your obesity? To what degree? And also diabetes mellitus. And I think those three things, it's not just an on-off switch, it's not black and white, but it's it's this gray area in there, taking all of those things into account.
So in geriatrics, we talk about chronological age and functional age. And this is one of those times where chronological age doesn't always tell the whole story. And functional age, to Dana's point, really plays into that.
So define what is geriatrics? What age is that, do you think? Be careful with your answer.
I know, I'm a little bit hesitant.
Well, go ahead, just tell the truth. Let's just hear it.
We often think of geriatrics as 65 plus, but again, it's not about chronology. It
You're
really
rescuing
is about
yourself. Keep
function.
going. Well, because functionally, I'm still a teenager, is what I say to you, at least in the way I act. Okay, Jess.
Okay, so Terry said she heard that Barnes Hospital in St. Louis is vaccinating older employees first. After the frontline workers are vaccinated, will us here at the health system, will we vaccinate by department or age and pre-existing condition? Do we know that yet?
Well, that's a great question. You know, we are working through that. Barnes also got a lot of doses of the vaccine, I think, so far. I've heard as many as 10,000. I don't know if that's accurate or not, but I've heard they've had a lot of vaccines. So they probably have a great algorithm around that. They're a smart healthcare group. We've used right now exposure to COVID as the most important parameter, no matter age. And that in part is because of the number of doses we've had so far. And so as we look at that list, what we've prioritized is the units that are being exposed to COVID, whether you're a physician, nurse, environmental services worker, respiratory therapist, et cetera. So it's your degree and your intensity of exposure. As we get more vaccinations available, then we'll start going into greater groups. We also looked at age and comorbid disease. But when you started looking at units where there was a lot of COVID, it began to break down, became harder for us to do that. And in part because you had to also stagger. You couldn't give everybody the vaccine on the same day from one unit in case they had side effects, and then they had to stay home, and then you couldn't take care of the patients on that unit. So a lot of things we had to consider as we do that. But I think as we go further down the list, we may be entertaining other variables than we have so far. But that depends on our supply of vaccine.
I just want to take that statement back to nursing homes. So we do know that some people on the next day or two after getting the vaccine will have some side effects. And you might have heard me mention that in the facilities, the pharmacy only comes for 3 days. And so we are not actually in that setting able to stagger in the ways that health systems and hospitals are able to do that.
Yeah, makes sense.
So there have actually been algorithms that have been devised by the CDC and have moved through our local task force here that determine when a person might maybe get a point of care test when they're in the building if they're having specific symptoms, or when they would actually need to stay home, because certainly we need to be sure that we're differentiating that out so we aren't without staff for some reason.
Yeah, and Hawkeye, I think one of the things we've observed so far in our vaccine clinic, on the first vaccination, we're not seeing a lot of side effects.
Yeah.
So we'll think about whether or not we still want to have to worry about that as much. But the second vaccination probably is going to have more.
Yeah, I think we've done pretty well as far as having side effects. You know, we have a hotline you can call in. There's also CDC apps or a site that you can go to have identify if you've had any side effects or anything like that. But we've done really pretty well since we started.
All right, so Katia, she is an ER nurse, and she asked, do I need to rush to get a vaccine since I already have antibodies?
Oh, that means you may have had COVID already, because that's the only reason you would have antibodies. And
Yeah.
what we've said is that you've had COVID. Really, waiting for another 3 months post that illness is probably really safe, because you're probably pretty protected.
Yeah, absolutely. And we know this happens. This is with one of your colleagues. I was up on the ICU last week talking about it. And, you know, the ICU physicians and nurses and respiratory therapists and all those, you know, they've had their chance to get the vaccine. And he actually said, well, I can actually defer and give it to somebody who needs it more because I've actually had it. So typically we would say, yeah, defer for 8 or 12 weeks if you've had it and you have antibodies, because the general thinking and certainly the guidance from the CDC is that really you still have some immunity against reinfection in that 3 months after you have the infection. So if you can hold that off and allow the supply to get to people who haven't had exposure to the virus yet, but they are in those high-risk places, then it's probably a good idea to go ahead and do that.
Lillian wants to know, what specifically does the staff at long-term care facilities need to do to change bringing the virus to their patients?
That's a great question. So
It's the same story for all of us, though.
it is. It's the same story. So really, everything that we are asking all of us to do, right? So masking, not being in large groups, physically distancing, those are things we need to do at home also. It's not like you leave the nursing facility and suddenly there's no virus, right? So we need to do all of those things at home. We need to make sure that we are protecting ourselves and our families and the people that we care for in the nursing facilities.
All right, question about the storage of vaccines. If the Pfizer and Moderna vaccines are similar, how could the temperature storage requirements be so different? Do we know that?
That's a great question, yeah.
Good question.
And in fact, it's interesting because Pfizer, I think, what I've read at least, had assumed that they need to be ultra cold storage. They hadn't studied as much on cold like what we're seeing with the Moderna vaccine. It's not like Moderna can be sort of room temperature. It's just more standard freezer temperatures.
Yeah, we don't know the full story behind this, but I heard some stuff as well as you did that Pfizer had wanted to get their EUA out, to get the supplies out to the people, to be able to get the vaccines out to protect people. They knew it was stable at those temperatures. So that's what they applied for. That's how it's been done so far. Is there a chance they can go back and look at it and say, oh, okay, well, maybe we can store it at a little bit warmer temperatures than we're doing? Because even after they had rolled some out, they said, well, maybe you can keep it for a little bit longer at this temperature, at a little bit the warmer temperature. So hopefully as we get further into this, we'll understand that maybe it is stable. We don't know that for sure. I think it is helpful with the other Moderna vaccine about the temperature not needing to be as cold. And there are other vaccines that are on the market too that don't have the storage issues that Pfizer or even the Moderna vaccines have. And that's good because just more ways to roll out these vaccines to the mass populations, not just here in the United States, but around the world in general.
Is there a part of the senior population who should not get the vaccine?
Ooh, good question again. Man, our listeners are listening.
No.
You want to say that again, please? No. So everybody should get it.
Yeah.
I mean, we don't have a reason, I have yet to see a reason that anyone shouldn't be excluded from receiving this vaccine.
And Hawk, even if the people have a significant allergic history, what do you think?
Yeah, now we've seen a few more cases of that anaphylaxis or that adverse reaction after the first dose of the Pfizer vaccine. Those are still being investigated, but kind of really now the last thing I read was if you have an allergy, if you had severe reaction to other vaccinations and or you have a allergy to any components of that vaccine. So still fairly vague and broad, but we are kind of trying to find some more information about these specifically.
So really, and just to say that as you approach a geriatric age, ho, 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 you get a little less likely to have anaphylaxis, right? And so, especially in the nursing home population, the whole anaphylaxis thing may not be quite as relevant, you think, as it is in a younger population?
Sure. So less likely to have anaphylaxis, less likely to have side effects, right? Which, is something that, of course, we're closely monitoring. And when they come and do these vaccines at the sites, the pharmacists are actually bringing an entire kit of equipment just in case that something should happen. But really, the reports that I've heard about older adults, both in the trials and then this has already been rolled out in some places in the country in the facilities. I have yet to hear any reports.
So what's the buzz inside the nursing home? Are people thinking, I'm ready, let's get this done, let's do this?
There is a massive education rollout that is happening. Right now, we have found in some pre-surveys that about half of the staff are all excited about the vaccine, and clearly we need to get that to a higher number. So I know that if the facilities that we have contact with are having education to staff, really just about what the vaccine is. Sometimes we're afraid of what we don't understand and what we don't know. So really just explaining how it works, how it's different, how it came out so quickly, and all of the safety mechanisms that have already been put into place and looked at. And we're hoping that will increase that vaccination rate.
Okay.
Donnie wants to know if we could get an update on any therapies.
Oh, all right. New therapies coming up. So right now, the monoclonal antibody therapy, New England Journal of Medicine, suggesting, hey, it looks pretty good.
Yeah, the monoclonal antibody therapy, again, this is for outpatient therapy. This is for people who are at risk of hospitalization, and what it is lab-derived monoclonal antibodies, so one type of antibody that is directed against particularly the spike protein. You get that infused within 7 days of your symptoms, and that will help reduce your risk of hospitalization. So we are using that in the outpatient setting. There is still a lot of problems. I think we are doing a very good job in trying to get more people to get the infusion, but I think around the nation there is a difficult time because of the systems that are needed and the engineering in the places that are needed to be able to do that infusion. The other thing is for inpatients, it's still remdesivir, which is that antiviral. It's still the anticoagulation and still the dexamethasone if you meet criteria for that. Those are really the mainstays. There is another kind of monoclonal antibody that you can use that has been EUA approved but is not recommended by the NIH at this point. There is not enough information for or against, and that is baricitinib. That helps reduce really the inflammatory process, kind of like steroids. But we're really not using that unless you really don't have access to that dexamethasone. So those are the big things as far as therapy goes in the hospital and in the outpatient setting. We aren't using the convalescent plasma anymore. More of the data said it really wasn't beneficial to be using that. So those are the big.
And monoclonal antibodies are actually being piloted in 7 cities around the country, specifically in the nursing facilities.
I think they're cool. I think it's going to work. I'm excited because the 70% reduction in hospitalizations, that could be really good data for especially the elderly population. All right, last question.
Okay, last one. Okay, can pregnant women get either vaccine, Pfizer or Moderna?
Yes. Short answer is yes. And if you are in those high-risk groups that even this past week have been offered and you are pregnant, you should be offered. You can take it, but if you have questions, ask your OB-GYN.
And pregnant patients inside nursing homes?
We don't have very many pregnant patients, but pregnant staff who are breastfeeding, absolutely, we're encouraging them.
All right. Hey, tomorrow, Chris Brown joins us. He's been a visitor with us before to explain why he rolled up his sleeve to get the COVID-19 vaccine. Dr. Brown cares for COVID-19 patients here in the hospital, and he will talk about the impact on him and on the staff who are in their 10th month on the front lines. Okay, team, final thoughts. JKR.
Just everybody keep on keeping on. We're getting somewhere. It feels like there's a light.
The airplane and the sleigh have a destination.
You know, it is an exciting time with the vaccines. Hopefully the rollout will give more supply, more vaccines into the arms of the people that need it. We will keep up to date on if there are any new changes in the virus or anything of that nature. Right now there is still just a little bit amount of information and data, but we will keep up with it. Hopefully it won't have any effect on the protection that the vaccine offers.
You know, there is a beautiful, one of my favorite holiday songs is one called This Simple Gift. And this mask is still your simple gift. It's the gift to others to say, I love you, and there's nothing you can do about it. And it's a great gift because it keeps on giving, because it keeps people safe. Masking works. And we know that defense is important. Just asked the Kansas City Chiefs yesterday. All the talk was about the New Orleans Saints defense. Who played better? Look at the Chiefs defense stats yesterday. They had a great game. So, Wednesday, we're going to have a visit from Santa Claus, so remember that, come Wednesday. You might recall asking you several weeks ago for the 50 reasons you love to wear the mask. Now, I have to tell you something. That was supposed to have been a song, 50 ways to leave your lover, get out the back, Jack, don't make a new plan, stand, and all that stuff. But the songwriters team wouldn't allow us to sing the song on the air to the tune of 50 reasons to love your 50 ways to love your mask. By the way, we made the song. It was cool. We can't play it. So if you know the songwriter, just send him a note and say, hey, Scrooge, let us play the song because it's really cool. But instead, we have a reason to do that. Santa got a hold of our list, and he's been checking it twice, as well as watching to see who is mask compliant. We'll take a look at what he found. And then I had this other great idea. You've heard that song, Sweet Caroline? How about Sweet mask of mine, bum, bum, bum. I have never looked so good. So good, so good. We could do that song.
Yeah.
So we're going to have to talk to Neil Diamond next. We'll see how that goes. In the meantime, remember, your simple gift, wearing a mask, takes care of you. It's not how fast you get the vaccine. It's how vigilant you are with following the rules of infection control, which protect you today, tomorrow, and every day. That is your greatest holiday gift. We'll see you tomorrow.